Social distancing has become a buzzword amid the COVID-19 pandemic, and health experts are saying that in the absence of a cure or vaccine, it's a tried and tested public intervention to control a disease. But what does social distancing really mean? Let's watch this.
Postponed, stay home. Don't come in, don't embrace, don't shake hands. Elbow bump instead. Around the world, people have been bombarded with pleas to maintain a distance from one another. Sports, political, and cultural events have been canceled following the World Health Organization's coronavirus pandemic declaration. Dr. Liana Wen, visiting professor of health policy and management at the George Washington University, says it's time for governments to be more aggressive in their response.
Now is the time for aggressive, bold action. And city municipal leaders should be doing everything they can to reduce the rate of transmission of COVID-19 in their communities. So everything that is non-essential should be canceled.
That includes social distancing measures. What does it mean exactly?
Social distancing refers to these non-pharmaceutical interventions because they don't involve medications, but rather they involve steps that everybody can take. So for example, avoiding mass gatherings, not going to big events where there are many people crowded together, taking certain actions ourselves as individuals, as well as having the government or private companies and businesses impose certain restrictions as well. So for example, canceling rallies or switching to telecommuting or shutting down schools.
As the coronavirus continues to spread across the world, politicians, sports, and entertainment figures have also embraced elbow bumping as a healthier way of greeting others instead of shaking hands or kissing on the cheek.
And in fact, cut out shaking hands altogether and going to another form of greeting. Now, I realize that this is a change for many people and is a change in habit, but it is an important and very simple thing that we can do to try to reduce the rate of transmission of this disease.
The World Health Organization also encourages the public to maintain social distancing. Countries around the world have been grappling to contain the virus, with some of them restricting travel to virus-hit nations. Dr. Bruce Aylward, who's a top advisor to the WHO chief, says gains from this measure don't last long. He urges governments to learn from China.
The majority of cases and new cases in China right now are due to importations. China is not putting travel bans in place. What China has focused on is how do you find these cases rapidly? How do you get them isolated, et cetera? And they recognize if we start putting travel bans in place, people are going to come anyway, and they're going to work to avoid those, and we're going to have a harder time potentially finding it as quickly as we want to.